This is a narrated walkthrough of the medical legal visualization prepared for the case of Brad Pitfall. This visualization was created for the Sequential Medical Communication course instructed by Dr. Lila Lax and Professor Michael Koren and submitted on November 27, 2012. This narrated walkthrough is meant to demonstrate how this visualization might be presented by an expert witness in a courtroom. The visual evidence is separated into 3 modules which are based on a series of axial head CT scans obtained for Brad Pitfall on 3 dates. The first module corresponds to the day of October 16, 2008, immediately after Brad Pitfall's traumatic injury. The second module to the day following an emergency procedure, and the third to a follow-up head CT 4 months later. Before we proceed to the visual evidence for the case, we will first review the authentication of the data. The authentication demonstrates the accuracy with which the visual evidence was prepared. Regions of injury were delineated on each radiograph and used to prepare the 3D models. When making these delineated regions transparent, we can see that they perfectly overlap with injuries evident on the CT scans. We use this same technique for all images in the series and for all data sets from all 3 dates. Now moving on to the visual evidence for October 16, 2008. On the day of the injury, there is a fracture of the skull in the left parietal bone. Directly beneath the fracture, there is a significant epidural hematoma lying between the surface of the brain and the skull. Looking at a closer view, the hematoma covers a large area of the left hemisphere. Moving around to the front, it is evident that the hematoma, which is 14 millimeters in thickness, is compressing the brain. There is a slight but noticeable shift in the midline due to the pressure on the brain, as evident by the shifted ventricles. This visual evidence is supported by the radiological report. Here is another view of the hematoma and ventricles, which similarly shows the midline shift to the right. In addition to the major hematoma on the surface of the brain, there are a number of smaller injuries within the brain. There are numerous punctate hemorrhages in the left temporal lobe, and there is also blood collected in the basal cisterns. To review, the largest injury in this date is the epidural hematoma, but there are also several smaller injuries in the brain's interior. Finally, we'll compare a section from the hematoma with the radiological scan. The day after Mr. Pitfall's collision and emergency craniotomy procedure, we see evidence of a left-sided craniotomy, a flap that was created in Pitfall's skull in order to drain the hematoma. A small area of surrounding edema has softened the brain tissue of the temporal lobe, resulting in sulcal effacement. The well-defined grooves of the brain tissue have softened and become spongy. New injuries have appeared deep to the surface of the brain. These are multiple cortical contusions in the left frontal and temporal lobes. The largest of these cortical contusions measures 2.1 by 1.8 centimeters in size. This evidence is supported by the radiological report. To review, There is an area of edema causing sulcal effacement in the temporal lobe, as well as multiple cortical contusions ranging in size in the left temporal and frontal lobes. The largest of these contusions is demonstrated by the radiological cross-section. Four months after the injury date, there are persisting areas of injury. There are areas of encephalomalacia, also known as Wallerian degeneration, on the surface of the left frontal lobe of the brain. These are regions of degenerated brain tissue that have become filled with cerebral spinal fluid, or CSF. These regions of encephalomalacia extend internally into the brain and are found in the frontal and temporal lobes. The left temporal horn has enlarged or become prominent to compensate for this space. Here is a view showing the depth and extent of the degeneration in the frontal and temporal lobes. The Wallerian degeneration is persistent, and the radiological report supports this visual evidence. In this top view, we see that the left temporal horn of the lateral ventricles is enlarged as a result of the degeneration. To review, we see that there is persistent degeneration of the brain in the frontal and temporal lobes, and there is a prominence of the left temporal horn of the lateral ventricles. The degeneration is demonstrated with this radiological scan. The visual evidence for this case was created with the aid of references. And that concludes the narrated walkthrough of the visual evidence for the case of Brad Pitfall. Thank you.